Hello everyone, welcome to We Pet Lab. Iatrogenic injury during urinary catheterization in male cats has long been a persistent challenge in clinical practice. Today, using the We Pet highly realistic lower urinary tract model for male cats, we will visually demonstrate exactly how such injuries occur. As you can see, the distal urethra of the model is obstructed by crystalline sand and stones, preventing urine from flowing out. Now, we'll invert the model to simulate the actual position of a cat lying on its back during catheterization. Catheter-related injuries mainly arise from two aspects. First, friction damage to the entire urethra during catheter insertion. When we use an open-ended catheter to flush through the obstruction, although the sand and stones are pushed aside, residual crystals remain in the urethra. If the catheter together with its guide wire is inserted directly at this stage, these crystals will continue to rub within the gap between the catheter and the urethra, leading to unavoidable urethral trauma. The correct approach is to have an assistant assist while flushing with saline, gently advance the catheter, continuously washing residual debris back into the bladder, and then proceed with bladder irrigation. Second, damage to the bends of the urethra's S-shaped curves. If a rigid flushing catheter is inserted directly, its tip can press against the urethral curve, causing localized injury. Again, the proper method is to ask an assistant to help straighten the urethra near the penile, opening before flushing and inserting the catheter. However, even with the distal urethra straightened, the second S-curve often cannot be fully addressed. As shown here, a rigid catheter may still injure the urethra at this point. That is why using a soft catheter for both insertion and indwelling becomes especially important. A flexible, highly bendable catheter can significantly reduce damage to the urethral wall and bladder lining. Furthermore, high-quality soft catheters are typically made of silicone or polyurethane materials with excellent toughness that resist kinking during indwelling, greatly improving placement stability. When determining a catheter's intended use, do not judge solely by open-ended or side holes. The key lies in the catheter material itself. Any catheter prone to kinking is suitable only for flushing, not for indwelling use.